This conference is being recorded. Only the main conference is recorded.
Good morning, everyone. We still have a few more people joining us, so we're going to give it a couple more minutes.
Good morning. First of all, I want to wish everybody a happy new year. Glad to see everyone in the year 2022. I hope your New Year's are off to a great start and everybody had a wonderful Christmas and you got everything on your Christmas list and maybe some nice surprises that you didn't ask for, but hoping that everybody's Christmas was productive, wonderful, blessed, and we're all ready to get started with 2022. In spite of all of the things that we had go wrong in 2021, it's a blessing to indeed still be here. And we're hoping that we can get started on the right foot and that this year will be even more blessed than any of the years we've seen up to this point. Thank you all for agreeing to get on this call with us this morning. We really want to go through some things with you as it relates to the rate increase that you all received on October 1st, 2021. We want to first tell you what it is that we're meaning to do with this webinar, and then we're going to walk through some of the things that that we have in store for you as it relates to the compliance part of the rate increase. As many of you all know, legislature appropriated $16.3 million in state general fund dollars from the New Opportunities Waiver Fund to fund a provider increase for the state fiscal year 21-22. We at OCDD and at the department were asked to take this money, use it for match, and then provide a rate increase to providers of home and community-based services for our DDE program recipients. We did match that money, and we were able to give a $2.50 rate increase to services that provided direct care to persons in our home and community-based programs. That rate increase was applied based upon how the actual rate or unit of service is actually billed and paid. So for the most part, there were quarter-hour units, 15-minute increments. We then split that money up as needed to apply the equivalent of a $2.50 per hour increase across the board for all direct support worker services. As part of that rate increase, we did rulemaking as required, and the rules were published as an emergency rule in October. But yeah, in October of 2021, as part of the rulemaking, and I want to kind of share a part of it with you on the screen, that we are looking toward starting the process of following the rule as written. And the rule had two parts. The first part was that we were going to establish a direct minimum wage floor for direct support workers of $9 per hour. Part two was that the department will then provide to providers the equivalent of $2.50 per hour in order to facilitate the establishment of that direct support worker wage floor. That floor was slated to begin October 1, 2021. So for all direct support workers who provide direct support care to persons in our IDD, home and community-based services programs, they could not be paid any less than $9 per hour starting on October 1, 2021. We sent out correspondence, I think through lasers, that provided you all with a letter that detailed exactly what it is that we were asking you all to do. We even went, Assistant Secretary Julie Foster Hagan held several webinars to explain to you all as providers what the expectations were with the emergency rule. So I think we had a pretty good understanding of what it is that we were asking of you, and what the purpose of the $2.50 rate increase was for. Lastly, the last part of this increase is, the last part of the rule was the department was expected to establish audit procedures for the direct support worker wage floor. OCDD has been charged with audit of the wage enhancement. And what we're looking to do now is explain to you all how we intend to conduct the audits for the $2 wage pass-through. So here's what we're looking to do. Based on the rule, we're gonna have Dr. Sylvia Malonson, who is director of our business analytics unit. She's going to go over the expectations of the audit, what will be needed, how it will be conducted, and then we'll then come back and talk about the last part of the rule, which is penalties and sanctions. But for now, I'm going to turn it over to Dr. Malone to go through the actual monitoring and audit process with you.
Good morning, everyone. I'm Sylvia Melanson, Director of Business Analytics, and my unit is going to be conducting the audit. Within our section, we have a monitoring unit, and I just want to talk to you about what you can expect. You don't have to write any of this down because it will be sent to all the providers by way of a letter, and you'll be contacted individually when your agency is up for review. So the first part of the process is to establish that the minimum hourly wage floor of $9 is being met. So what we'll need for that is 1 November 2021 payroll cycle that lists all of your direct service workers. We are only interested in those that work in home and community-based services. And we are only interested in the ones that are providing DD services. So if you cannot separate your employees, let's say that you also have ICF or you also are working with OAAS, we prefer if you could separate that out and only give us the OCDD home and community-based direct service workers. If you can't for some reason, we need you to very clearly label which ones are pertinent to this process. So you'll need to tell us which ones are IDD and which ones are home and community based. So that's the first part of the process. We'll need to see everyone's records in that payroll cycle. If you're using a system, a software system like QuickBooks, go ahead and provide us with that documentation. It needs to be from your system and an actual verified source, not just a Word document with everyone's name and their wages in it. We need to see your actual payroll records. So that's the first part of the process. We're going to be looking at everyone and making sure that that minimum hourly wage floor is met. The second part of the process is a legislative reporting review, where the legislature has asked for us to provide a report of how the money is being spent overall in terms of direct service workers. So for this part of the process, we'll need 2 monthly payroll summaries for August 2021 as well as November 2021. So we need a before and after this went into effect for comparison. Some of you will have payroll twice a month, some once a month. We just need we need 2 monthly payroll summaries. So we need to see all payroll periods that fall within August and November. The summary is, again, just going to be for DSWs in home and community-based DD services and DSW supervisors. We want to know the total count of all your DSWs that are full-time, part-time, and contracted. We need the total hours paid at the regular rate of pay and the total wages paid at the regular rate of pay. Same thing for overtime. We need the total hours paid at overtime rate of pay and the total wages paid at the overtime rate of pay. We will need for you to also identify certain employer-related expenses paid for the month, like your workers' compensation premiums, FICA. If you can't break that down, you can report it separately as SUTA, FUTA, and Medicare taxes, but only the employer-paid portions. And then we also are requesting information about any employer-paid benefits, such as health insurance premiums, 401k, or any other retirement plan that you might be contributing to. Bonuses count, as well as mileage reimbursement. So all of these documents have to be very organized and clearly labeled. We're not asking you to compute anything. We actually have a spreadsheet where we are going to be taking the information that you give us and just plugging the information in. And I can show you that spreadsheet in a second. But make sure that everything is very organized, clearly labeled and identified so that we know which staff are OCDD home and community based. And we don't want you to include any management or administrative costs in this report. All of the documents are going to need to be provided within 14 days of the request, along with a signed attestation that the documents are verified and true. So we will be sending you this list in the form of a letter so that you have it and you'll know what to start preparing. And we actually have several members of our staff that are going to be reaching out to you and requesting this documentation by way of email. So I will, at this point in time, let Charles talk to you about the sanctions.
Okay, so Dr. Malonzo has given you all the basic things that we're going to need to conduct our audits. Now, the last part of the rule required or gave authority to the Louisiana Department of Health to provide sanctions to providers who did not meet the requirements of the rule. The punitive portion, or let's say the sanctionable portion of the rule, is the payment of the minimum wage floor. The minimum wage floor of $9 is the part of this rule upon which you will be judged as to whether or not you actually complied with the rule. So no employee, direct support worker for IDDD home and community-based services can be paid less than $9. When we review your documents, we're going to be reviewing for that minimum base wage of $9 for all of your DSWs. If it's found that you have employees who provided care after October 1 and they were not paid the $9, then that is a possible and likely sanctionable offense. The sanctions range from what may be a simple fine per incident up to and through removal of your ability to provide services in the Medicaid program. But the severity of those sanctions and how they're administered will be done by Medicaid. The Program Integrity Unit will receive a report from OCDD providers who we found had not met or had not complied with the rule. And then it will be up to Program Integrity to determine what the appropriate response for non-compliance is. And I'm assuming that once we turn in information to Program Integrity, then that process will be managed by Program Integrity, and they will deal with the non-compliant provider individually. Again, it's not our intent to have a punitive system. However, the rules were set up to ensure that the direct support workers were the beneficiaries of this rate increase. So non-compliance will lead to possible sanctions by the department, but I'm hopeful and prayerful that we won't have anyone fall into that particular category. But as we go along, again, it'll be up to Program Integrity and the Medicaid program to determine what the possible penalties are or sanctions are for non-compliant providers.
Switch back to the agenda. I mentioned to you all that we have several staff that will be contacting you by way of email with the required documents. They're all on the call, but because they're not panelists, they're not able to mute and show you their faces. But I just wanted to give you their names so that when you get an email from one of these people, you know it's legitimate. There are a total of 5 staff that are going to be requesting documentation. Luan Johnson is their supervisor, so she may also reach out occasionally. And those 5 staff are regional. They are surrounding the state, but we are making sure that they're not going to be conducting any reviews within their own regions. So Omega Chopin, Greg Williams, Kim Frazier, Dwayne Degater, and Patricia Wagasback are the 5 staff. They are going to be reaching out via email. They will attach the list of requested documents to you. And if anything else is needed for clarification purposes, they'll have some correspondence with you after that initial request. Again, 14 days after the request is made, you're expected to supply that information. Again, we are not asking that you calculate anything, compute anything. We're just asking for you to supply us with the payroll records. And we do have a spreadsheet that we are going to be putting everything in. I'll even show you what it looks like. Let's see. Okay, this is it right here. So we will be taking the information that you supply to us and putting it into this spreadsheet for the 2 payroll cycles that we are requesting documentation for August and November. And you can see it has a breakdown of the regular and overtime hours, as well as wages, and those related employer costs that we discussed. Okay, so that's pretty much it. This is the attestation statement. We will be sending this with the request for information for you to sign and send back to us.
Okay, so that's about it. We've tried to give you exactly what it is that we're going to be expecting from you all to comply with the monitoring process. We've tried to go through the rule once again, and I know many of you had already seen copies of this, but we're hoping that we're going to be getting this started in the next 2 weeks as required to provide information to the legislature once the session starts. So let me go through, looks like we may have a few questions. I'll try my best to try and answer them for you. Hold on one second. Let me go to the Q&A. Okay, the first question. Does this include long-term PCS and CCW services? No, it does not. The $9 minimum wage floor was only applied to home and community-based service DSWs under the IDD waivers. That's the Now waiver, Children's Choice waiver, Supports waiver, and Residential Options waiver. Next question, would a letter come through postal mail or an email? We're going to try our best to get it to you through email. If we don't have a viable email address for you, we will send it through the regular postal mail. But it's our intent, wherever possible, to get this to you electronically, and we would expect the information back from you electronically. Okay. Next question was, it says that, however, Mr. Els is saying it was for all DSWs. I didn't say that. I said it was for home and community-based service DSWs only. We did not receive any other Now Fund funding to do anything with OAAS, home and community-based services, nursing homes, or ICF DDs. This is strictly for DD home and community-based services. Next question, are van drivers included as direct support workers? That's not a question for me to answer. That's a question for you as the provider to answer. If your van driver provides direct support care, then they would be included. If not, I would think that they were not included. But that's not anything that we get to decide here. You as individual providers, you determine who are direct support workers and if they provide direct support care to IDD program participants. Let me see. All right, let me go to, all right, there appear to be some questions in the chat. All right, hold on one second here. No one will ever accuse me of being, okay. I have a question here. It says, is the pay increase staying or will it go back down? Also, can we get a copy of the agenda so we have the names and the information? The pay increase, as far as I know, is temporary. There has not been any funding for this rate increase going after June 30th, 2022. Whether or not it remains in effect depends directly upon what happens during the 2022 legislative session. So as of right now, this is not permanent funding. Getting a copy of the agenda, yeah, I guess we can put the information up. Okay, so we've displayed again the agenda and the names of the persons who will be responsible for the monitoring program. So you could take those names down if you would like, and everything. These will be the individuals who will be contacting you all about getting information for the monitoring. Okay. Let me see if we have another question. Let me see. There was a change in ownership mid-August, resulting in pay periods being processed by different owners and 2 different payroll systems. Will reports be needed for August from each owner or just the new owner? Well, we're going to need them for both. I guess that's the safest way to do it. If there was a pay period cycle and a second pay period cycle, both done by separate owners, then we would need to get both of them. And then we could then make the changes we would need to make or to add or to look at that individually so that we can, generally if we add them up, they should total. And the total should allow us to get what we need. Here's what we will do. If we have any questions or concerns about any of the information that was provided, or we need additional clarification, the monitor that's looking at your agency will contact you and request additional information or request clarifying information so that we could have so that we could get the best information into the worksheet. And that clarifying information may come from a simple explanation, or we may need to request things like check stubs or other kind of records. The rule as it was written gave us authorization to get whatever we need in order to clarify, compliance with the rule and reporting. So, but you know, if there's information that's needed, we will have an email box where you can send clarifying information to monitors so as to make sure that we have an understanding of exactly what was done and why. Okay, let's see if there are other questions. Okay. What will be the revisionary period for the temporary rate increase? I'm not quite sure what a revisionary period is. I'm not quite sure. If you're asking what will be the review period, I think Dr. Malonson mentioned earlier that the month of November will be the month for the $9 compliance period. We will request payroll information for all DSWs for the month of November, and we will be checking that for compliance with the minimum rate floor. The period for the reporting of the effectiveness of the rate increase will be monthly pay, the total monthly payroll for the month of August, the payroll summary, and the month of November. So those will be the two periods that we will be reviewing the information. Right. So now let's, but I want to let you all know that we won't be probably requesting all of this information from all providers at one time. We've been able so far to come up with 498 individual providers who may be affected by this rate increase. We will have, not all providers will be contacted at the same time. Each of our monitors has a caseload that ranges between 99 and 100 providers each. So it's not, you know, some of you all may be contacted a little later than others. You will be selected randomly. So it will not be alphabetical selection or largest provider selection or smallest provider selection. You all will be selected randomly, and then you'll be contacted by the individual monitor that will be responsible for your reviewing your provider agency case. And but some of you all may be contacted a little earlier than others, but we will get around to all 498 providers.
Last four questions in the chat.
Okay, let me see. How do I get back to it? Okay, another question from the chat. When will you send out information pertaining to the changes? I don't exactly know what information you're referring to. We sent out information about the $9 increase back in September of 2021, prior to the effective date of October 1, 2021. We did, Assistant Secretary Hagan did a webinar such as this with most of the providers a while back. That was in September. So all of the information related to the changes that we were expecting was sent out back in September. I think this is being recorded, so you will be able to look at this again for your records. But I do think this webinar is being recorded. Question, do we need to sort the staff groups if we applied increase of wage to all DSWs regardless of waiver type they serve? Yes, yes. We don't have any authority to review or look at any non-IDD waiver DSW rate increases. We just don't. The rate increase was supposed to be for IDD waiver DSWs. So that's all we have authority to look at. OAAS waivers, the community choices, and the ADHC waivers, they were not included as part of this increase. As by law, you cannot fund non-IDD waivers with money from the New Opportunity Waivers Trust Fund. So, you know, we won't be looking at anything outside of OCDD, home and community-based service programs. Okay, so I think that's about it. If you have any further questions, please, you know, send them to us via email through the email box that we will be providing to you all. And once again, thank you for agreeing to, you know, sit in on and participate on this webinar this morning with us. And we look forward to talking to some of you all this new year. Thank you very much.